Local health authorities have not been able to conclusively determine the presence of any of the new COVID-19 variants in the country, more than a month since the Eureka Medical Laboratory revealed that testing had unearthed several suspected cases of another variant of the disease. Minister of Health Dr. Frank Anthony, in providing an update on the 10 patient samples which were sent to the Caribbean Public Health Agency in Trinidad and Tobago 3 weeks ago, said on Tuesday that the ministry is still awaiting confirmation on whether any of the new variants, which are said to be more highly transmissible, is in Guyana.
So far, we haven't received back the results, so we are not sure if there are any variants circulating here.
During an exclusive interview with this newscast on January 5th with Paul Chetty, head of the virology department at the Eureka Medical Laboratory, it was announced that the lab had stumbled on several patient samples that were missing a specific gene, which presumably indicates that patients may have been infected with one of the new COVID-19 variants. He noted, however, that the lab is unable to confirm which of the new variants it was, since the facility lacks the capacity to conduct the gene sequencing procedure. 2 weeks after that shocking discovery, the health minister disclosed that 10 patient samples were sent to CARFA to be tested for the new strains of the virus that causes COVID-19. In a recent interview with Nightel News, Dr. Anthony was questioned on whether the samples were randomly selected to be sent to CARFA or whether there were indicators which influenced the decision to send them. He outlined that the laboratories used a specific criteria for identifying the samples to be sent. The minister also noted that the samples sent overseas included the suspected samples from the Eureka Medical Laboratory.
We did reach out to Eureka and ask them to provide us the samples that they thought they had found a variant on. So we asked them for the sample. And those things have been included in the set that we have sent to CARFA.
He added that arrangements have been made to send at least 10 samples to CARFA on a monthly basis to ensure consistency in testing for the new variants. He reminded that the gene sequencing procedure is complex and can take extensive time. Temika Rodney reporting for the HGP Nightly News.